Tualatin, and I'm a nurse practitioner. We're here today to highlight the essential work Oregon House Democrats are doing this session to support our working families. The last 2 years living through the COVID-19 pandemic have particularly impacted 4 areas: healthcare, behavioral health care, childcare, and education. Today, you'll hear from Representative Lisa Reynolds and CJ Alejandro, a behavioral health care worker, about the work being done to support our behavioral health workers so we can better treat Oregonians struggling through mental health and addiction crises. You'll hear from Representative Travis Nelson and Allison Seymour, a nurse who works with Medical Telemetry Care Unit at Salem Health, about the staffing crisis and mental health challenges facing our nurses. You'll hear from Representative Karin and Rebecca Ellis, a childcare provider from Bend, about the tremendous toll the pandemic has made on our childcare system and the work we have ahead to make childcare more affordable and accessible. You'll hear from Representative Teresa Alonso and Darnell Williams, a teacher, about the work being done to recruit and retain educators to combat teacher burnout so that we can keep our kids in healthy, safe classrooms 5 days a week. When not legislating, I'm providing healthcare at the bedside of people living in long-term care. I know what our profession has endured the past few years. As a state, we need to prioritize the safety and wellness of our nurses. I had days during the height of the pandemic where I needed support provided by the Oregon Wellness Program. As a nurse practitioner, I have access, but we must ensure all types of nurses have that access. One bill you will hear about today will ensure all nurses have access to that kind of support and to encourage a cultural shift in the nursing community towards acceptance of mental health services and expectations of well-being. For all the bills that we're highlighting today, I want to emphasize that there will be more work ahead. No one bill will solve the various challenges facing working families in our state. But it's for work like this that the short session exists. We are responding to address these crises on behalf of working families. And with that, I'll turn it over to Representative Lisa Reynolds.
Oh, I think you're on mute. Sorry.
As Representative Reardon said, I was rehearsing. No, good morning. My name is Lisa Reynolds, and first thing this morning, we are going to hear from Mr. A.J. Alejandro.
Thank you, and good morning, everyone, and to members of the media. My name is CJ Alejandro. I'm a social worker and a parent working at a large mental health agency in Portland, Oregon. I'm speaking in support of House Bill 4004. And so I'll just tell you about when COVID started, I was working at a secured residential treatment facility for 8 people with severe and persistent mental illness. And so we were providing 24/7 around-the-clock care to provide food, medications, hygiene, cleaning, basic socialization, crisis support, everything for these folks. And when COVID lockdown went into effect, a lot of people were able to stay home from their jobs, but we were not afforded that option. We had to continue going in every day. And one thing I can teach you about trauma in the 1.5 minutes I have is that it sticks with you a lot longer when you're in a situation you can't leave. And we were kind of all stuck, the same, dozen of us for how many months. While we've all experienced the pandemic and experienced this trauma, our frontline workers in healthcare and mental health care have absorbed a disproportionately high amount. And these are people, in my case, that had barely, below living wages, who were tasked with supporting people who were the most vulnerable in our society. And so, we watched our people go on ventilators. We had one facility nearby where nearly 30 people died in the first wave. And we continued going into work. Thankfully, with union efforts, we were able to get a small daily COVID incentive. But I'll tell you that ended about 1 year and 1 day ago. And as you are aware, the pandemic has not ended. So what I'm asking for today is to consider us providing wages that correspond to the kind of risk and effort that our mental health workers are enduring. And with that, I will hand it back to Representative Dr. Reynolds, who will discuss what House Bill 4004 does in depth. Thank you.
Thank you so much, CJ, for sharing your experience with us. And again, my name is Lisa Reynolds. I'm the state representative for House District 36, and I serve as vice chair of the House Committee on Behavioral Health. I'm also a pediatrician, and I see firsthand the behavioral health struggles of our families. And my concern over Oregon's frayed behavioral health system was one of the reasons I decided to run for office. And of course, things have only worsened in the COVID pandemic. Look, our behavioral health system is in crisis. Care providers are struggling. They are overwhelmed and underpaid despite how essential their work is to the health of our communities. And here's the bottom line. We must be willing to pay family wages for this life-saving work in order to recruit and retain providers and ensure that our longer-term behavioral health investments are successful. One bill this session will do this. House Bill 4004. First, it would create a grant fund to distribute one-time direct payments to behavioral health care providers. Most of the grant money must go towards staff raises or retention bonuses, with the rest going towards hiring new staff and improving working conditions. We're requesting $132 million towards this grant program, and funds will get out of the door quickly, no later than May 31st. And be assured we will be tracking results closely. Furthermore, House Bill 4004 seeks to increase our base pay, like what we pay providers for the care they give to Medicaid patients. This overdue systemic change will help make sure that our essential behavioral health care workers earn wages that support themselves and their families, and it will help us grow and retain this important workforce. Short sessions were made to address emerging issues and crises, and House Bill 4004 provides a solution to our ongoing behavioral health emergency and ensures that Oregonians receive the comprehensive behavioral health support that they need. Thank you so much. And now we're going to hear from Allison Seymour, a registered nurse.
Hello. Hello, my name is Allison Seymour. I'm a registered nurse, certified med-surg RN. I also serve the Oregon Nurses Association board as secretary. I've been a nurse for the past 6 years, and I live in Salem, Oregon. It's been stated that frontline nurses and healthcare workers are carrying the burden of the pandemic, causing significant levels of mental and physical fatigue, exhaustion, and moral distress. I'm here today to tell you a little bit about my story and my personal experience with COVID and the horrible effects of poor staffing. Last year, my unit was designated into a COVID unit, and we were devastated by that Delta wave. We had patients waiting in the halls and the emergency room for just to get access to a bed. I've had the horrific experience of holding up a cell phone for a dying patient so they can say goodbye to their loved ones over FaceTime. I'll also never forget the experience of being at the bedside of a patient for days while she was progressing through death. And then due to poor staffing, I got another patient, had to leave, and I wasn't there to help her pass. You don't forget things like that. And many of us are left scarred by these experiences. When a hospital or a single unit is understaffed, patient care is compromised. Most of the time, staff compensates, but there are still documented missed cares and certainly delays in cares and extended wait times. These delays mean patients wait. No one likes to wait, especially when they're scared, sick, and alone. Nurses and other frontline workers are the face of healthcare. We're the first ones to say, sorry about the wait, even though it's not our fault. But it still seems like our fault. I felt and carried a tremendous amount of guilt during that time. I was also verbally and physically attacked by multiple patients due to wait times. One was due to a cold breakfast. The extreme stress, lack of meal and rest breaks, uncertainty during surges, an ongoing risk of infection to ourselves and our loved ones, equipment challenges, staffing shortages, and not staffing to acuity or intensity per our law have a price, and I've carried it. Many months of living through the pandemic on top of this crisis has made the work virtually impossible. The trauma of these experiences don't stay within the walls of the hospital. It leaves when we leave. I remember having a panic attack driving home one day because I saw a motorcyclist speeding down the road, and I started crying because I knew that our ICU was full, and if that guy got into a wreck, he wouldn't have a bed and probably wouldn't survive. I've been having nightmares, and I've also seen the emotional toll that this takes on my other colleagues. I know about 20 of the 100 so that nurses that work just on my unit that have left the unit or quit. Last month, I joined them. I left my job because I couldn't take it anymore emotionally and physically. My goal is to return soon and recover my mental health, take a rest. But I want to express sincerely how demoralizing it is to be constantly understaffed and to be underserving our patients that deserve better care, but don't get it because we don't have the resources. This was an issue prior to the pandemic, but now the problem's illuminated. This has been a disaster waiting to happen. We got into this challenging work because we know we can make a positive difference. Oregon nurses make a difference. But we need to build a pipeline of nurses to enter the field to get more boots on our ground. And we need better retention strategies. We also need to collect data and have more confidential health support for nurses. I'm so appreciative of the work of the legislature is taking on this session. Thank you. Thank you. House Bill 4003 sets the stage to make some major improvements in how our nurses are treated. And I really look forward to supporting this work continuing on throughout the years. Thank you. Thank you very much.
State Representative Travis Nelson, Northeast Portland. I'm a registered nurse too. As you just heard, this has been a devastating 2 years for our nurses. We've rightfully been called heroes, fighting this COVID-19 pandemic on the front lines to save lives. But if we're going to be called heroes, then we must be supported like heroes who have risked our lives during multiple waves of this pandemic. Up to 40% of nurses have left acute care, and many more are considering leaving the profession. If we don't act to attract and retain healthcare workers, it will be a long-term disaster for our healthcare system. The public and those most in need may not have adequate access to care. People die when hospitals aren't staffed appropriately. I've been a nurse for nearly 20 years, and I've never seen anything like what we have collectively experienced during the COVID-19 pandemic. I know too many nurses who've grown fatigued by the working conditions and have burned out from the lack of support and day after day spent caring for the extremely sick. We had staffing challenges prior to the pandemic, but it's the number one reason we are seeing people leave this incredibly important line of work. And now, after 2 years in a pandemic, we're beyond a crisis point. House Bill 4003 will make progress to add short and long-term solutions to address the nursing staffing crisis in this state. This bill will immediately help nurses and nursing students by developing a working nursing student program with licensure requirements. This bill will help to ensure that nurses are covered by the Oregon Wellness Program to support their mental health needs. We've heard the tragic stories of nurses dying from COVID-19, especially in the early days of the pandemic. Nurses have lost friends, loved ones, and have been witness to immense tragedy. We desperately need this support. This bill will update statutes to extend emergency licensure requirements for staffing shortages from 30 days to 90 days, meaning we can retain some of our nursing staff for longer periods of time. The adjustment will also cover all types of nursing, not just critical care, to ensure that we can support in place across the spectrum of hospital care. And lastly, I'll add that we're going to keep running into the same staffing problems until we address this issue. We'll continue the work during the interim for bolder policy in 2023, We need to ensure a long-term nursing workforce pipeline so that our nurses have every opportunity to effectively do their jobs. Thank you.
Let's see, who's next after Representative Nelson?
Darnell. I think we're going to
Okay,
hear from
great.
Darnell. Yeah.
Great, Darnell, we look forward to hearing from you.
Hello, everyone. My name is Darnell Williams. I'm an educator in the Happy Valley area. If I were going to use one word that describes the last couple of years teaching, it would be hopeless. Teachers are used to having to do more with less, but when things are already held together with paper clips and Scotch tape, only so much can be done. Teaching students takes preparation time, which is built into our days as teachers. But with COVID and the health and safety protocols, the teachers that would cover our prep time are often sick, and there was no one to cover. So teachers are having to teach day in and day out without having that prep time. The only option is to work extra non-paid days after contract time to prepare for the next day. Other issues that have made teaching this year more challenging include, but are not limited to, pressure to recoup learning loss from distance learning from last year, including moving forward with state testing this year, the creation of digital lessons that match in-person instructions that can be accessed by students who are quarantined. Further, educators are faced with the student body coming back to school with social emotional problems. Many schools didn't have the support staff like school counselors, mental health professionals, or nurses before COVID. Without these key staff members in the schools, there is no one who could help the older students who have had to deal with a maturing interpuberty with only having the internet and forums as their compass on what is acceptable behavior in public. I am thankful for HB 4030 and the relief it will provide to the current educators. This is a critical Band-Aid to a gushing wound that is the staffing crisis in public education. And it will help us attract and retain essential school staff, from teachers and instructional assistants to school nurses and counselors, so that we can give students the support they need to be successful. Your actions here show that our cries are not falling on deaf ears. I am grateful and hopeful that this is a step forward towards permanent solutions in the future. Thank you.
Good morning, and thank you, Darnell. And thank you once again for joining us today. My name is Representative Teresa Alonso, serving Woodburn through the north part of Salem. I'm also chair of the House Committee on Education. I want to tell you a little bit about myself and why the work we do in education is so important. When I was 4, like so many Americans whose ancestors came to the US for a better life, I came to Woodburn, Oregon with my parents from San Jerónimo, Purinchiacora, Michoacán, Mexico. My parents were farm workers, and we faced many cultural and financial barriers. Some days we had to choose between paying for things like healthcare or food on our table. As a kid, I had to navigate Oregon's education system many times alone. I experienced firsthand how students like me were too often denied the resources needed for us to succeed. The odds were not in my favor, and yet here I am today, forever grateful to serve as a legislator and a voice for all our students, K-12 and post-secondary higher education. That's why for this 2022 legislative session, one major priority for me and for many of my colleagues, including those across the aisle, is our education workforce. Senator Dembro and I, as the 2 education chairs, collaborated to ensure we address some of our education workforce needs during the session. Since before, and now during the pandemic, our teachers and classified staff have sacrificed so much, but with little recognition and support. We call our teachers and classified staff our heroes, but they are also burned out and overworked. Without the right support systems, many feel they have no option but to leave the workforce. We're even facing a substitute teacher shortage. We have to change that. Students learn best when they're learning in healthy, safe classrooms 5 days a week. We need to make sure that teachers, classified staff, and schools have the resources, support, and staffing they need to be successful so that our students can be successful. When teachers feel supported, our students feel supported. House Bill 4030, our committee educator workforce bill, is an investment in our teachers and students. It is a result of listening to students, teachers, classified staff, instructional assistants, and every other component of our schools, and channeling that into effective actions to help recruit and retain talent. One of the most important aspects of House Bill 4030 is that it will give state dollars to help districts pay for recruitment and retention bonuses for teachers and staff in critical high-need areas like special education teachers and instructional assistants, bus drivers, school nurses, and counselors, as well as substitute teachers, for example. The bill will also remove unnecessary bureaucratic hurdles, allowing teachers and out-of-state licenses to get licensed in Oregon, as well as funds to help substitute teachers and instructional assistants receive certification and professional development support without added cost. But last but not least, House Bill 4030 updates our systems, bringing them into the 21st century by creating a statewide jobs and educator portal so that teachers and classified staff can see where the job openings are and schools can see what educators are available. To be clear, this is a first step to addressing a long-standing need. The bill will provide important infrastructure and funding that will make a difference for this and next school year. But we are committed to finding long-term solutions in the future sessions so that our students and teachers can continue to be successful. Thank you. Now we'll hear from Rebecca Ellis, a childcare provider. Thank you.
Thank you and good morning. My name is Rebecca Ellis. I am a parent and co-founder and director of a nonprofit co-op childcare center called ReVillage in Bend, Oregon, which opened in the midst of the pandemic in response to the scarcity and barriers parents face in accessing high quality, affordable childcare. When my family relocated to Bend for my job, we had 2 school-aged children and 1 child under 2 years of age. After relocating, my husband found a job, but we soon realized that the cost of childcare would almost equal the amount of his paycheck at the time. Gratefully, I have a flexible job and an understanding employer, which, while not ideal, has made it possible for my husband to work some hours as we juggle kids back and forth without having to afford the high cost of childcare. Even so, it has made it difficult to keep up with the cost of living, restricting how many hours my husband can actually work. I consider myself privileged because I can be here today, though. We haven't had to lose our house or cars or jobs. Other families in our community are in a much harder situation, and this has only been compounded by the effects of the pandemic. They're losing their homes, they're quitting jobs they love, and they're being pushed to the breaking point. As a parent, I've experienced the stress and frustration that comes with feeling stuck and financially stretched as you are unable to fully provide for your family. As an early childhood educator, I understand the importance of providing a healthy foundation for our children's most formative years, and that childcare workers who are entrusted with our children during these important developmental stages should be paid a living wage for this underappreciated yet vital work as early learning professionals. As a childcare provider, I have been part of a team walking alongside families who also feel stuck with no answers or support. We're doing our best to offer this support, but it is a monumental task and we can't do it on our own. I'm really glad to see all of these lawmakers here today and excited to hear about the bills that you're working to pass in Oregon. And I'd like to especially thank Representative Karin for her amazing leadership on House Bill 4005 and the Child Care Emergency Response Package, and for the effort she's led as the chair of the House Committee on Early Childhood. And from one mom to another, I understand the cost involved in doing this work. So thank you, Representative Power. Thank you all.
Thank you so much, Rebecca. The personal story you just told is consistent with the experience too many Oregonians have faced for years. As you've just heard, there's an incredible strain right now on our working families and childcare providers. I'm Karin Power, State Representative for Southeast Portland, Milwaukee, and Oak Grove. As the parent of an 18-month-old and a 5-year-old myself, I know firsthand what Oregon's childcare crisis looks and feels like. Even before the pandemic, childcare was hard to find and unaffordable for many families. Today, women's workforce participation has dropped to levels not seen since 1991, and more than 2 million women have left the workforce since February 2020. To the Oregonians who have had to make the difficult decision to put your careers on hold in order to care for your children, particularly working moms, we are here today to say that we see your struggle and we are trying to make systems work across the state. That's why our priorities this year include stabilizing our childcare workforce and infrastructure. As we begin to emerge from the pandemic, we must continue to build a system where every family can find care, so our children have joyous, reliable, and meaningful early childhood experiences. We can only reach this goal if childcare providers and workers are paid well for their essential and difficult work. That's why I'm really thrilled about the progress we can make this session with House Bill 4005 and the budget framework that the Childcare for Oregon Coalition has put together. House Bill 4005 will increase the amount of money providers who accept employment-related daycare, ERDC, subsidies received per child, getting to more equitable rates, and this will also increase purchasing power for parents who utilize ERDC. I'm also very excited to support the Childcare for Oregon Coalition's budget requests for 2022, which include $21 million for direct recruitment and retention payments of $500 each to currently working childcare workers, one payment in 2022 and one in 2023. $39.3 million to recruit and train new providers and provide direct grants to expand existing facilities of all types. $5 million to childcare resource and referral services, and $4.3 million for the Department of Early Learning and Care to make our public childcare system more equitable and beneficial for parents and providers. These investments and more are targeted at retaining our current provider workforce, many of whom make close to minimum wage, and building greater statewide childcare capacity so families can find safe and loving places to care for their kids while they're at school or work. We need to build an economy that works for working families. Oregon families are counting on us to help them, and I look forward to ensuring that we get these investments over the finish line. Thank you.
Thank you so much, Rep. Power. Now we're going to go ahead and take questions from the press. If you could please use the raise your hand feature, and I will go ahead and call on folks. Not all at once, please. Oh, I see we have a hand. Sorry, I don't see who it is. If you want to go ahead, you can ask the question. And if you could please just state your name and which outlet you were. Oh, I think, oh, Dick. Yeah, go ahead, Dick.
Thank you. Sorry, I was having a problem finding where my hand was. And I'm also having problems illuminating myself. This is a typical question for me. Which of these bills have Republican support? Feel free not to all answer at once.
Thank you, Mr. Hughes. It's Representative Rachel Prusak here. We've all worked with many stakeholders for these policies, including Republicans, to develop successful legislation. Workforce shortages aren't unique to Democrats or Republican districts, and we've worked hard to ensure we have a solution that will reach every corner of the state. And so I know the policy I worked on, House Bill 4003, nursing policy, left the Healthcare Committee with unanimous support, and I believe all of these bills have Republican support.
Thank you. And if I may ask a question, particularly about childcare, an issue dear to my heart. that our family struggled with 30 years ago, and I don't know that it's gotten any better. And the question is, why the heck hasn't it gotten better? Because that certainly seems to be a bipartisan issue for people of all economic levels, except maybe for the very wealthy. And what do we say to the people who think, well, government has no role in childcare? I think that's probably for Representative Power.
Yeah, I'd love to take that one. And I think you're right. I hear stories from folks even today who recount their childcare experiences decades ago, like yours, where it was expensive, difficult to find, and many people had to patch together childcare in order to continue to work. I think for too long, it's been seen as an individual family's obligation to find care. And the way that the pandemic has highlighted how essential this is, I think is changing policymakers' minds. And we're seeing new momentum across many different states to make major investments in childcare. It is an essential component of being able to get people back to work, but it's also an essential component of fun, loving, early childhood experiences for children. And data increasingly shows that the investments we make in kids when they're little has benefits for families and children throughout their entire lifetimes.
Just to follow up on that, if I may, Representative, I have a friend, highly educated, involved in your line of work, as a lawyer, who says, well, can't people just find a family member? I'm sure there'll be aunts and others willing to take care of kids. How does one get them to understand that many of us don't have people available? I mean, Leave It to Beaver doesn't exist if it ever did.
I think the pandemic has placed a unique strain even on our friends and family networks. I know, for example, my in-laws moved here to be closer to their grandkids, and yet before vaccines were available, they were very cautious about spending time with our family because of underlying health conditions. So the ways that people used to be able to piece together care or have somebody run to pick up their kid from school or daycare when you had a meeting running late or got stuck in traffic, those supports for many people went away during the pandemic because of the health risks. And we've seen in testimony before our early childhood care committee that unfortunately some providers have decided to stop providing care due to their own personal health risks or finding a better paying job. So it's a multifaceted problem we're trying to tackle.
Thank you very much. And I would just like to say to the nurse who spoke earlier that I had a severe breakthrough case that put me in Salem Hospital for a week last fall, and I'm still experiencing long COVID, and my care was superb with outstanding nurses, and I am so grateful for all the medical staff and all they do.
Thanks so much, Dick, for sharing that. And now we have Katherine Brown.
Thank you. I'm actually a colleague of Dick's with EO Media Group, and I'm in Pendleton at the East Oregonian, and I publish a magazine called The Other Oregon. But also personally, in Pendleton, I am on the board of a nonprofit childcare center called Pendleton Children's Center, and we have been trying to tackle the childcare shortage here for over 2 years, since actually even before the pandemic. It was pretty much at crisis level then, and so much worse now. And this is, I'm not sure if it's so much a question, but just I'd like to hear people's reflections on this. While I deeply appreciate all the emphasis on paying childcare providers much better wages that they deserve, it has really been my impression here that the problem is not that there are not enough people willing to provide childcare, it's that there are not the facilities in which to do so. Most churches in this town have basements. If they have extra space, they're in a basement. The childcare and licensing specialist would just say, nope, the bathroom's too far away. It would need literally hundreds of thousands of dollars worth of renovations to start. We have been fortunate here in that sadly, our senior center closed and donated that building to our childcare center. So that's giving us a big boost. But I realize, you know, our impression is that this is a huge problem. It needs a huge solution. It's going to cost us, I'm certain, $5 to $6 million or more to renovate enough space to provide childcare for 150 children from ages 6 weeks up through the time they go to kindergarten. And I think every community in rural Oregon could probably use a $5 or $6 million facility to start taking a bite out of the shortage. So sorry, I can talk forever, but I will let you talk now. Thank you.
Oh, Katherine, I'd love to connect offline. I too can talk about this forever. It sounds like you have a great opportunity there to capitalize on some donation. States are beginning to take this on, especially in partnership, hopefully with federal dollars to invest in this area. And we know facility improvements and finding facilities to host kids is one of the major barriers to expanding childcare. It is our hope that with increasing provider reimbursement rates for taking children who receive, or families who receive some state assistance, that will enable them to be able to afford to open more facilities as well. And some of the dollars we're going to be investing in the budget package will go towards capacity or capital improvement grants. But I'll connect with you offline later. We're continuing to kind of work on the facilities angle.
Thank you. I want to give one more opportunity for questions. If anyone has any other questions before we wrap up. And just so folks know, we recorded this, so I'll be sure to send everyone the recording when we're done. Great. Well, thank you so much. And thanks to, all of our workers here today and legislators and the press for coming together this morning to talk about these crucial bills, and appreciate everyone, taking the time on an early morning to do so. So great. I'll be sure to send out the media kit and recording. Thanks so much, everyone, and have a great rest of the day.
Thank you, everyone.
Thank you all very much.
Thank you.
Thank you.